So our last question looks at the immunity or resistance of bacteria to different antibiotics. So we have Pseudomonas bacteria, which causes infection in hospital patients. A new strain of Pseudomonas bacteria has evolved. The new strain can only be killed by one antibiotic, which is fluoroquinolone. Scientists want to prevent the new strain of Pseudomonas from spreading in the human population. What advice do we need to give the doctors to prevent the spread of this new strain? So there's 5 or 6 things we can talk about. So the first one is don't prescribe the antibiotic. I'm going to refer to it as, rather than having to write fluoroquinolone every time. For mild infections, they'll probably get better due to the body's normal immune system. Normal immune response. Don't prescribe it for viral infections. Which is pretty obvious because antibiotics don't kill viruses. If you do prescribe it, make sure you finish the course. Make sure they finish the course, because any bacteria that survive will have higher resistance due to lack, and they'll be able to reproduce rapidly due to lack of competition. Has any bacteria left? So they're the ones that didn't die, so they're going to be more resistant than all the ones that did. And then only prescribe it if the patient has the new strain. So, and because if you use it regularly, it would lead to an increase in the resistant bacteria. So again, key things for this one are to think, have you made as many relevant points as possible, and have you given it in detail, and are they logically linked to form a clear account? So you can only access the level 3 marks, which is 5 to 6 marks for this question, if it's a logical account and if you've made all those relevant points.